to record. It's a little late, but better late than never. But Vera, if I could, the first question I'd like to throw to you, some with us today know you and some don't. So the first thing I'd like to ask you is, can you tell us a little bit about why and how you have chosen to dedicate your life to the field of addictions?
Okay, thanks, Tony. I think I know probably half of you, so you already know some of my story. I have two sort of thrusts that have pushed me into sort of making this my campaign or my passion. And the first one is, I guess, personal, in that I, like so many young women, started struggling with weight and then got caught in that horrible up and down of weight cycle in my 20s, and was persistently puzzled by the fact that I would be successful and then lose my success over and over and over again, and it just got worse each time. And it wasn't until my professional interest of addiction, which you know, I was a family doctor initially, working in the HIV field, and when the circumstances around people got better, I wasn't really interested in just doing family medicine, so I started to read up on addiction, because in my neighborhood it was either HIV or addiction. I live in downtown Toronto, urban downtown Toronto. And in studying about that, I started to connect the dots, with some of the dots of which we'll talk about today, about basically how the behavior that I saw and lived with myself with such exasperation was played out with so many variations on a theme. You know, the cocaine user, the cigarette smoker, nobody came in for cigarettes, but I was also a smoker, and actually found quitting smoking the easiest of all of them. But anyway, alcohol and cocaine and even crystal meth being the same pattern. And then just finally to say that I was just continually reaffirmed that food addiction, besides the fact that people, even professionally today, are unwilling to acknowledge it or embrace it, the people themselves suffering from addiction, like crystal meth or cocaine or alcohol, would, like me, be in exasperation and go, I can't believe there's yet another addiction and it's even worse than the first one. So I saw it on all fronts. And I really believe once you start looking and listening, you'll see it everywhere. But, you know, we live in blind ignorance, thanks also to the food industry, which I think you guys say something nasty about that, right?
Oh, yes, we do. Yes, I will. We most certainly. We have a little tradition here at Motor Nation, and you can probably see a bunch of faces smile here on your screen here. We have a tradition around here. It actually started from the Seinfeld episode with the Houston Astros and the New York Yankees. But every time you hear the word food industry in our room, we go, those bastards. Okay. And empowerment is a big part of what we do. Thank you very much. You most certainly are one of the most genuine people that do this. And as I, you know, when I first started to get to know you and read your material, I think it became, or not think, I know it became very apparent that because you walk the talk, you have gone through the same struggles as your patients and those that you're working with, helps make it much more relatable and understand. And just on the concept of food addiction, we're definitely going to delve into that today. In my time, and I think the documentary was the biggest slap in my face. Until you've experienced our struggles, it's very difficult to get. So brings me to the first question. I realize it's probably the most frequent question that you get, but it's important to throw this out there. So the question I get most asked, and I'm sure you do, is how can you possibly be addicted to food? I mean, you got to eat. I mean, if you don't eat, you die. So I mean, how do you answer the question of, you know, how can you be possibly addicted to food versus alcohol or tobacco?
Yeah, so, you know, there's kind of two answers to that. And the answer that most of us usually give is, you know, it's not food, it's specific foods. Of course, we have to eat, but we don't have to eat sugar. So, you know, And when we talk about sugar, we're not talking about the sugar in an apple or a carrot, even though both of those can have quite a lot of sugar. We're talking about the processed refined sugar, and that really brings out the whole debate about should we be calling it food addiction? Why don't we call it sugar addiction, processed food addiction? Those are much more accurate. But I'm in the camp. I don't know if you're going to ask this question later. I'm in the camp that says I'm happy with the food piece because the sugar and the processed food, which is usually the first stage, that's what, like in that diagram that you showed, or the cartoon that you showed, everybody wants to have just one more when they're eating processed food. But eventually, later stage, I mean, you can be struggling with just volume addiction. I eat far too many good foods like carrots and beets. That's what's wrong with that. Vera, you said that's fine. There's, it's in its an unprocessed variety, but food addiction can progress and develop to a stage where it's much worse. But then there's the question about whether food is, how can it be addictive? Well, how can sex be addictive? It can be addictive, although it's a natural behavior. How can gambling be addictive when it's premised on the fact of curiosity? I want to know what will happen next. That's not addictive. When I'm wanting to, well, I suppose you could say a Netflix binge can become addictive. But if I want to know what's going to happen on the next scene or the next thing, and so I'm compelled to stay and watch for one more vignette, that's not addictive. That's I guess somewhat addictive behavior, but it's not addictive. It can become addictive though if I'm stuck on the internet hours and hours and hours. So even normal behaviors can become addictive, and that's where we get into the whole neurobiology.
Yeah, and then I mean, an exercise would probably be another the example that it can be taken to an extreme. So then, and we'll move on from this point. So in terms of just addressing the whole food be addictive, so we're really focused on foods that really aren't food. These are foods that have they may have started as real food at one point in time, but they've been processed. Either things have been taken out or things have been put in. So we're really, as a starting point, we're talking about foods, or as Michael Pollan likes to call them, edible food-like substances, or that's really the distinguished thing. So then that takes me to the next question, and you tapped into it, and we can spend the whole day on this. Then how does a person kind of distinguish between, whether it's the occasional overindulging or maybe not so occasional overindulging, the occasional let's just, forget the extra words. How do we distinguish between overindulging and addiction? Like, is there a fine line or a solid line between those two?
Well, so that's yet another, maybe not so much of a controversy, but it was, like professionally, why is food addiction not being acknowledged in the field as alcohol and even gambling or sex addiction? It's because there's all these little pitfalls and minefields, and this is yet another one. Why is it that, if we live in 2021, we're living in, and unless we're doing the eat real foods, thing, if we're eating processed foods, pretty much everybody is early stage food addict because, how can you not be? That's like if you live in a world where everybody smokes and you smoke, well, you're a smoker to some degree, but you may not be a real smoker where you need it. So one of the ways to define what makes an addiction has kind of been resolved now in the medical world by the use of the DSM-5, or the Diagnostic and Statistical Manual. And the DSM-4 had sort of clear lines of demarcation. And the DSM-5 said, no, it's not so much clear lines, it's a continuum. And most of us in the field addiction world applaud that. We see it as a continuum. So I walk in the grocery store, eat a few chips or peanuts or whatever, and can't put them down. There's a bit of an addictive tinge to that, but I'm not an addict. But if I progress, and the way that this is a neuroadaptation, because we're living in it's basically a normal brain adaptation to an abnormal environment. And if I'm eating foods that are no longer real foods, things will happen neuroadaptively that then look like addiction. And so how can I tell if I'm an addict? Well, the DSM-5 gives us some criteria, which you can find publicly on the internet just by looking at, what are the 20 questions of, am I a food addict or whatever. I can give you some of those examples, but let me first of all do I have the time to go a little bit into the criteria per se?
Absolutely. I can actually pull, because I have it close by, the 10 questionnaires. Would that help?
No,
okay.
Not just yet, in a minute, because that'll be an illustration of this. I'm not going to go in depth about this because that could go, we could spend a whole hour just on that, but just, do you have an obsession or what we initially call a craving, which then becomes an obsession for your food, where, that takes mental space, so that if I'm here talking to you guys and I'm really thinking about the tub of ice cream that I'm going to have later, there's something, crowding into my space. So, and it might be to the point where, what, I'm going to ditch this and I'm going to go and have the ice cream. So that's the obsession, like how much that actually interferes, is one feature. Another feature is if I now am eating more than I want to, neuroadaptation, tolerance follows. I know you're going to ask me that question later. And so now I need to have 2 tubs instead of 1 to get that nice feeling, because otherwise I just feel, if I don't have the 1 tub at least, then I feel bad, which is dependence. So, dependence tolerance is the next sort of feature. And then the feature after that is, if I'm having this much, even though the 2 tubs feels just like 1 tub, it is 2 tubs and it's causing a 2 tub damage. So is there damage that's happening because of that excess? So we've got obsession, we've got the damage and tolerance. And then finally, if when I realize I better stop because all of this damage and, I'm obsessed too much and I can't stop, then that would be the 4th criteria. I keep trying, but the obsession is so strong, and the tolerance, the dependence, I cannot get through a night without having my substance. That's the sort of last thing. And then the final sort of cream on the cake, as it were, is denial. Right? That, like with any other medical psychiatric condition, it can be anorexia, it can be anything. The person doesn't see it the way it really is. So instead of the anorexic who says, I'm fat, they don't see that they're not. We think tomorrow it's going to be okay. It's just today. The sort of lies that we tell ourselves. So all of those features, if you fit all of those and the level at which you do, that's how extreme your addiction is. And then illustration is, now, do you want to show your list there?
Yeah, we can pull it. Yeah, so I have the 10. I've always gone with the 10 questionnaire. I'll just pull it up, and I think it's and you can Google this. It's the Yale Food Addiction. I'm going with the 10 because I find it. And these are things. I don't know if you just
actually, you know what? I'm gonna. Those are. Can I interrupt you there?
Yep.
Yeah, that's actually not the Yale, and don't even bother looking for the Yale because it's a scientific.
There's a class today at 3 o'clock.
Can you we got to.
Oh, okay.
I think that's Vince. Vince, if you can mute yourself.
Yeah. So yeah, the Yale is a scientific tool which is of no use to a clinician or a patient. Like, don't even bother with that. This is very good. This is the 20 questions that actually comes from the 12-step world.
That's right.
And they illustrate those points that I was talking about. So do you want to stop and you just can't? That fits in with the I can't stop. Do you think about food all the time? That's the obsession. Do you get rid of the binge and then try to get rid of the binge? You'll notice some of these look very much like eating disorder. Yet another minefield. What's the difference between those two? Do you eat in private? Do you eat in secret? Because you don't want people to see how much and how. I mean, some people forget I don't need the plate. I'm going to eat out of the bowl or out of the bag and forget the cutlery. I'm just going to drop it in my mouth, like that kind of behavior, which, by the way, is attached with a lot of shame. Like with any addiction, like that crack addict who is out there right now in my park across the street is not happy about himself. He's feeling a lot of shame, or she. Have you ever stolen other people's food? So behaviors that a person would be loath to disclose, which is partly why we make it so public, addiction because you want to get rid of that shame. Anyway, all of those things illustrate that point, those points that I gave.
Yeah, my apologies. The yellow addiction. That's right. It's a much more for clinic. This is so you can. So those that are part of MODA, I included this in the last few workshops. So just looking at this list of 10,
but they do say the same thing. It's just one is very scientific and hopeless, and this one is very like relatable.
Yeah, it can get quite. And again, like if somebody's just in the earlier stages, it tends to get so complicated that it tends to you tend to stop. Whereas this one, you can look at it. So looking at these 10 points, it's basically 3 or more, if I understand correctly, that we're moving into. So just using this list, and we'll move on. And you talked about it, I think, in your intro, and a couple you've touched is addiction is progressive. So looking at this 10 points, is it fair to say the more you're ticking off, the further in the spectrum a person is?
I don't know. No, I don't think so. I mean, yes, I suppose if you ticked off 10, that's a sign. I think it's more the depth of the obsession, because like, that cartoon showed, it's hard to not, at a party when you've had a few drinks, to say no after, the first little nibble that the person walks by gives you. So things are addictive, but you might be having a food buddy and living in a world, which we do, frankly, where it's okay to eat. Like you go to a movie and it's okay to get a huge bag. And so you're eating privately, but you're not like, I mean, some of these things are just illustrations of I think it's more the depth of those criteria. How much am I obsessing? How important is it that I have that tub of whatever it is at night before I go to sleep? I'm just using the night one because that was one that was really hard for me. It was like, some people need their bottle of wine or their scotch before they can sleep. Other people need their particular food favorites that they need, or else they can't sleep. And then they can't sleep. And to what level are you willing to go all the way across town to get your favorite, whatever it is, as when you could just go downstairs and get something nourishing? So it's the extent, I think, that measures this. And then finally, the progression, because it's a neuroadaptation, I need more to feel not just normal, but so that I can get to sleep, but so that I feel better because I've had a hard day. I need more, and pretty soon anything, like I said, you can eat. Okay, I'm not going to eat the ice cream anymore. I'll have yogurt instead with, sweetener in it. So it has a modicum of being healthier, but it's, if I've devoted the same attention, it becomes just as addictive. And behaviors like binging or purging which certainly are part of the eating disorder continuum, can in later stages of food addiction look the same. So you have behaviors as well. So just virtue of eating, I need to graze all day. And how do I graze all day? Well, I throw up every once in a while to give room. That doesn't mean that person is a bulimic, although they look like it. Yeah, so it's that.
Yeah, in my experience is, I mean, our group is predominantly guys. We don't see too much bulimic episodes. We get, and it's one of the points in those 10 is the exercise. This concept. They'll look at it as a balance sheet. If I run or whatever the exercise is, it can. That's one of the things I see with guys. What I'd like to do, I think it's going to serve as a great summary, and we'll hone in 2 points. Share a paragraph from your book. If I could hear, I'm hopeful everyone's able to see it. Is it up?
Yep, it is.
Okay, so I'll share this, and I'd like to tap into two key points in here. So to the food addict, eating just a little bit of sugar or whatever the trigger food is, and I really want to delve into trigger food or the word trigger in just a moment, will set up the phenomenon of cravings. And again, unless you've truly experienced this phenomenon of cravings, the phenomenon of cravings that leaves him or her wanting more, that just one cookie or whatever it is enough to act as a trigger. And I love this analogy, like a lit match to kindling, It inflames a highly volatile reward pathway. And that reward pathway, we can get into so much detail, but it's just waiting to set ablaze an inferno that consumes willpower and makes it impossible to rationally moderate portions after that first taste. So a lot of information in that, but two key points I'd like you to tap into. So can you expand on that phenomenon of cravings, more so like the lighting of the match?
Yeah. Yes. So, there's a number of different analogies that I use. So the kindling is one. I mean, kindling is actually a term that comes from seizure. That once a person has had a seizure for whatever reason, alcohol induced or just whatever, they're more likely to have another seizure. There's something about the brain. It's probably part of this neuroadaptation, which is, again, an attempt for the brain to adjust to a new environment, which happens to be a toxic food environment in this case. And so that it doesn't require quite as much of a stimulation to have that same reaction. So you know how when you try a new food that everyone raves about, you taste it, it's not that great, but after a while it's like, oh yeah, that's really good, and then you love it. There's a neuroadaptation that happens, and it is like kindling, so that at a particular point I only need to have the taste of it and it flares up like a match to kindling. And another analogy that I use, we hear it a lot in the addiction world, is I'm allergic to alcohol, or I'm allergic to cocaine. I mean, the person's not really allergic, but what happens is, just like if you, there's a hypersensitive reaction. So another word for allergy would be hypersensitivity. And hypersensitivity is kind of like another word for a trigger. I am hypersensitive, or I'm allergic to sugar. You could actually say that if you wanted to get out of being offered something. You're not going to have a closed throat reaction and an anaphylactic reaction, which requires a visit to the hospital, but you'll have a reaction, a hypersensitive reaction. And with an allergy, what happens is you are exposed to that allergen. And by the way, the more you're exposed to it, the more, just like kindling, the more you're hypersensitive. So I don't need as much poison ivy the second time around to get the same reaction. And then I only need to get a whiff of it in the wind and I'll get a reaction, whereas before I had to put my hand on it, that kind of thing. This happens with sugar too. So here we are with the allergic reaction in the body. It's basically a histamine reaction. My body senses an allergen, responds with histamine, which is an attempt to rid me of the allergen through sneezing and scratching and all that stuff. In the brain, it's not a histamine reaction, it's a dopamine reaction. This dopamine is the neurochemical of want, of desire, and it's been kindled, and so I have a little bit, and now I want more. And I truthfully don't really want more. Because ask anybody who's binging, are you hungry? Do you really want that? They'll probably put their head up from the food and go, oh my God, I wish I could stop. But I want it. The itch, yeah, is so much. And the wanting is so much that I'm just trying to quell the want. And it doesn't work that way. It just doesn't. Unfortunately, we can't end wanting by pouring down more of this neurochemical of want. Every time you have more, you just want more.
Yeah, and there was a key point, right? And that's we want to stop and we can't stop. That's when you and Michael Moss did that fabulous podcast, and you were I forget the cigarette CEO, but that was the key thing. So the other really the word trigger comes up a lot, and in our journey of recovery, I think it's really important, or I think it's essential towards recovery, is understanding triggers. So can you just elaborate a little bit more? What do you mean by trigger?
Okay, so a trigger can be, and often starts as a physical trigger. So I have the taste of sweet and I like it, because our body, we are primed to like sweet and fat. They are energy dense, and we are born into a brain that already likes sugar. And some people may say, no, I don't like sugar, I like the savory. But the savory is usually flour or some kind of starch that eventually becomes sugar anyway. It's basically sugar. It's just a different version of it. It's like an unsweetened sugar, but it's still there. So there's a physiological relationship that starts because I like this. And if I have a potent amount of it, like processed food as opposed to a natural apple, I'm going to like it even more or have a stronger response to it. And then we have the psychology behind that. We make neuroassociations. When I do this, I get this pleasurable feeling, so I'm going to want to do it again. And if that pleasurable feeling brings me to a place where I don't feel my pain, if I stop using it and then I do feel pain, we develop a whole level of psychology on top of the physiology of the connection between me and sugar. And all of that is just encapsulated in this word called trigger, which you could say is like an allergy, but let's just use the language of trigger. Yeah. So when I have this one thing, all these associations are connected so that I just have to smell it, the Pavlov's dog thing. You just have to hear the bell. Oh, the clinking when you're making your booze and you hear the clink of the ice, that really draws somebody, or the smell of the beer as they walk by the pub. And here, the Cinnabon smell when you walk by, Bath or Subway. It doesn't even, all of this is association. That's trigger. Trigger is like the physiological, but mainly, ultimately, psychological association.
Okay, so the triggers aren't necessarily just the food. I mean, you talked about smells, places, people, any type of association. Yes, and that's something that comes with time. So another word, because we can.
And of course, the food industry really plays on that, right? Like they super play on that.
Yeah, just on that. One of the things that became apparent with me, I've shared the story before. One of the reasons in my early days of this, I had stopped shopping at either Loblaws Superstore. I had a certain asphyxiation with a cookie they have, and their display would just light me up. It was that visual association. And that's why it's very important. I mean, and that's the last point I'll make on triggers, and we can move on, is what might be a trigger for me or you may not necessarily be a trigger for somebody else.
That's right. I mean, there, like I said, there is a physical aspect to it, but it becomes much larger than that when we're talking in the addiction world. Absolutely.
So the other term that I think is very important to know and have a better understanding of, and you touched upon it, I think, in the introduction, the concept of tolerance is mentioned frequently in your book. Can you give us the executive summary of what exactly tolerance is?
Yeah, so tolerance is that's the fundamental crux of the neuroadaptation that happens. So if I have an extraordinary experience, which happens with refined sugar, refined foods, I'm having the experience of an apple and the sweetness of an apple. It's not extraordinary. I might remember that I happen to like Honeycrisp better than another apple, but I'm not going to go out of my way necessarily. Well, I might, but to get stuff like that. But when it's an out of the ordinary experience, the brain likes new because that's dopamine. I want this, and I usually want more. I want new and more. When you're in an environment where there's more, like we want it, but we only want it to a certain degree. And when we pass that degree, that might be the difference, actually. One of the differences, like I said, with the continuum of addiction, this might be the physiological difference of crossing that line. The brain then recognizes there's too much, we've got to make this too much the same. So it does what we call downregulates the receptors. The receptors from one nerve to another, which is the dopamine that's passing through from one to another, is, let's say there's 10, and if there's enough for 20, it's going to say, no, we don't want these 10 filled up all the time, and even more, we're going to bring it down to 5, so that even if there's 50, you're only getting 5. But you now have the memory, the psychological memory of wanting the 10, which is our brain likes extraordinary experiences. That's the spiritual experience. That's why spirituality is so important, folks, because we want this, we hunger for it, but we're trying to fill it with food, which is impossible because our brain will downregulate. And that downregulation, yet still the desire for more, is tolerance. And then dependence is the next step, which is, well, if I don't even have 5, forget about the 10 and the spiritual experience. I just want 5, because if I don't have 5, I'm -5. That's dependence. And that's where we get into big trouble.
Well, that's where the one-liner, and I'm a fan of the one-liners, the chasing the dragon comes from.
Yes.
I'm a big documentary fan, as you know, and anyone with us today, and David Crosby's documentary. All you got to do is, if you want to grasp this concept of chasing the dragon, and all you got, feel free to watch the whole documentary, but even just in the trailer of David Crosby, in his trailer, he nails the concept. I've showed it a few times at Moda, of chasing the dragon, that constantly, he's coming from the world of narcotics, but he just drives home how I just keep wanting more.
And you see, you didn't know that you wanted more, but you got that experience. That's the dragon, and the brain will not let you have the dragon. It'll always whittle it away, but you still want it. And that's the whole lie of addiction, is that you're promised this. It's almost like the original sin story. Eve eats the bite of the apple, or one of them does, eats the bite of the apple, and now they're doomed. Because they can never, paradise is gone, and paradise is just, now I want what I can't have. If you didn't know that you wanted it, you would have been fine. And that's the criminality of, our loss of innocence. When the mom gives their little kid, their first drug, and that can be sugar, for God's sakes. But anyway.
Okay, I see some stuff. 2 more points, and then so feel free to share in the chat box some questions. I see they're just coming in. So the other thing I'd like to talk about is 2 more points I'd like to get into that I feel are key. Relapse and recovery. So kind of thinking back to that phenomenon of cravings is something that I get asked frequently, and I like to throw to you, is does this phenomenon, does it ever go away?
Well, okay, so that is the same as asking if once you are a diabetic, which means that the receptor sites for insulin have been damaged, and now you have to live a modified life, either with medication or stop eating sugar. Insulin is really, diabetes is almost like the physical, and addiction is the mental aspect of the consequences of sugar. So anyway, once you're a diabetic, you're always a diabetic. So the moment you go off your meds or off your food plan, your sugars jump back up again. There's been something that's been damaged with the receptors in such a way that I don't believe you can go back to square one. And we don't see it with addiction, where a person can have a little bit of something. If they can, it's because they did not cross that line of tolerance and neuroadaptation. Good for you. If you haven't done that, it's like the person who can get away with social smoking or social drinking, but then maybe, when they're 40 and something terrible happens, they lose their COVID, they lose their job. I can tell you, we see a lot of COVID babies in the treatment center, with alcohol especially. That little bit more crossed them over the line. Anyway, if you've crossed the line, neuroadaptation has happened. I don't think there is any going back. So relapse is inevitable if you don't, like the diabetic, take the meds and change the food. The sugars will come back. So will the dopamine come back, because remember, dopamine is want. So if the kindling has started, how do I know that I'm relapsing? Because I'm starting to obsess. I'm starting to try not to eat it, and I still am, driven by this want, this need, which is dopamine. That is a relapse in action. And the only way that I, Vera, after 15 years or whatever, will not relapse is that I have to take my meds. And I am not actually on meds, but I consider my real food meds. But I have to do the things that keep me safe from this faulty wiring. It's essentially what's happened. In addiction, where there are so many of the faulty wiring is actually psychological, I believe that that's why we need things like this, MODA or 12-step program, some kind of social support to give us a bubble of safety just like the diabetic is in their bubble of what they eat, so that when those cues come, they can sort of deflect off the bubble as opposed to penetrate. Because it is inevitable. It's unless we take care of ourselves, which means protect ourselves from those triggers.
Yeah, and the one-liner, I think it was the first time I met you at the one of your talks, was once you become a pickle, you can't become a cucumber. On the concept. The final thing I'd like to throw to you, and then we'll go to the floor in the time remaining. It's not an addiction question, but you have a vast knowledge, and I really want to tap into this. So in terms of added sugars and processed food, it's very persuasive. Can you kind of give us your thoughts as a physician that's been, I think, well over 2 decades of your concerns when it comes to physical and mental health as it relates to the added sugars and processed foods?
Well, okay, so if you buy into the concept that this is an addiction, dopamine is that which is what's being hijacked, as it were, and it's actually not being hijacked; it's being magnified. Alcohol hijacks dopamine. Food doesn't hijack dopamine because food was made for dopamine. Like, that's the whole point about that, why it's so addictive. It was a shoe-in made for that. All I have to do is magnify, oh my gosh, now I lost your question. Can you?
Yeah, so the concerns about added sugars and processed foods as it relates to our health.
Yes. Okay. Right. So that same area of the brain, the reward pathway with dopamine, is also the very same neurochemicals that our mood is premised on. And if my dopamine is high, like I'm, getting ready for today's talk, and I'm going to go out and do something today, and I'm looking forward to something. If I'm depressed, that means that my dopamine is flat. I'm not interested. I'm not curious. I don't want to. And anytime your sentence begins with "I don't want," that's probably a feeling of depression. And when you are taking a drug like dopamine, like cocaine, like alcohol, that brings you into the stratosphere, and then you crash, inevitably your mood will also crash. Yep. And we have in the addiction field this new term that's bandied about all the time, dual diagnosis. It's maybe it's a dual diagnosis in the sense that you came into the world of your addiction prior with a diagnosis, but often it's the consequence, because how can it not be? There is no, I have yet to see an alcoholic who's been drinking for a long time, who's not depressed, who's not anxious, who's not bipolar, who's not even attention deficit. And so we have a characteristic feature of mood that follows alcohol. We have a characteristic feature of food that follows food. And that would be like attention deficit, like anxious, like bipolar, like up and down, because of course you're up and down. You have a crash and then you eat again. And mood is, it's the very same neurochemistry, which, if I can just add this piece, is why I get so annoyed when people say, how can food addiction exist? I want to say, well, how can depression exist? How do we know depression exists? We don't have a study or a test that we can measure, but we ask the person, so why can we not give the same respect with food, the struggle with food? Because it's the same kinds of questions and the same neurochemicals. I mean, this is
very good comparison. I mean, and even I think sometimes in the early days of diagnosing depression, it was kind of written off too. So hopefully that won't be the case down the road with food addiction, although it's getting more widely known. So I'm going to the floor here. Okay, with our time remaining. So there's a question here, and then actually there's two of similar. So I'll just say the one. Having a sweet tooth, even jerk, so just eat real food sweetness. I feel anxious to the point of pain. The pain makes me want more. And the other was volume addiction. So the person's asking that you comment on that. So having a sweet jerk tooth, I feel anxious to the point of pain. The pain makes me want more.
Well, okay, so that's a kind of twofold question. So the fact that you want more, I hear in that implied that I want more to relieve the anxiety. And so there's two pieces to that. One would be, can the anxiety be relieved? First of all, like if the person was sitting in front of me saying that, I would say, do you need to put extra safe parameters around your eating? Because we want you to eat the jerk. Like that's okay to eat. But if you're eating too much, for example, or every time you see it, you're frightened, can we put parameters around that so that you can eat safe food safely? For example, and this is an example, like that person, I don't know who that is, tells me that's probably somebody who's more along the line in the food addiction continuum than early stages. And so I'm not suggesting that for this person, but I'll just tell you for myself, I also worry about similar to that. And so I have adopted a safety measure of weighing and measuring my food, which sounds a little bit like, what, are you serious? But that means that when I come to the table, I never worry, am I going to eat too much of even the healthy food? I just know I won't because I've got a safety parameter. So I would look at, is there something that can be applied to, first of all, take away that edge of anxiety? Then the second thing is, why would you, I mean, food, especially processed food, is a drug, and it would be the same as if I'm feeling anxious and I know that I'm going to have a bottle of, or a glass of wine and that will take the edge off, or a Valium and that will take the edge off. Well, so will food take the edge off, but you're using a drug to take the edge off. So best is don't use the drug, find out what the edge is, and can we resolve that? Because JERF should not be giving you meaning eating real foods, should not be giving you that anxiety, but that could have developed because of the whole continuum of food addiction. There's a lot of anxiety around food.
Okay, so yeah, putting parameters or
don't feel bad about it. It's normal.
Yeah. Okay. So putting parameters or boundaries. Another excellent question here. Yes, actually comes from Kate also. But what makes one individual addiction prone more than another? So I think we're tacking into transfer. What makes one individual addiction prone than another? Oh,
Oh my God, you could write a thesis on that. That's a great question for. Oh my God, you could start a whole series of podcasts on that. So, I mean, there's the whole biological predisposition. So we've seen that people who have obesity in the family have alcoholism in the family. So there's been a look at, are the dopamine receptors themselves more prone or privy to being affected sooner than somebody else? And there's been a lot of attention at the dopamine 2 receptors with the nod to, yes, it appears to be that's the case. That's the same reason why I might be addicted to sugar. I'm more quickly addicted to sugar. There's probably alcoholism in my family, which is actually true, and also more likely addicted to alcohol. So there's definitely a biological piece, but there's the physiological piece. So we have the term, oh my gosh, Brian will know this, the adverse childhood ACE, adverse childhood event. I can't remember what the terminology is, but anyway, childhood adversity. If you've experienced and you have not learned how to moderate mood in the way that we should have learned in our teenage years, because the experience was too big or that you didn't have the parental exposure to help you, then often we turn to drugs. And the drug can be alcohol. It can even be cigarettes, for God's sakes. And then when you stop that, you haven't learned that tool. You've already learned basically the easy softer ways we see in addiction. And so you're going to find something else because you're basically kindled for a quicker solution. So it's biological, it's psychological, like adverse childhood experiences, and then just living in today's environment. Some people live in it more, like you, Tony, in your story, when you did your traveling and you went to every fast food joint as possible. That wasn't my story. So I got addicted into other foods, not those. See, so it's exposure as well.
Okay. Oh boy, so much stuff.
We're exposing our kids at an early age, which is terrible, I think. I mean, we're really priming them not only to become food addicts and diabetics, but also alcoholics.
Yeah, so concerning. Okay, now keep respecting your time. I know you got a 10:30, so
we're good. 9 minutes.
Okay, do you got time for one more?
Yeah, we got 9 minutes.
Okay. All right. I just want to give you some transition time. So another one here. How do stressors such as COVID pandemic affect us with our food choices or our ability to control our triggers or urges to eat the wrong food? So how do stressors impact?
Well, so the immediate question or answer that I think of is just any stressor at all. I mean, that would be like widowhood or loss of a job or whatever, invites, you've got a massive insult to your psychological integrity. And now it's very hard. It takes a long time. It takes a lot of therapy to work through that. You know, like how long does it take to get over losing a partner? You know, we think 3 months and we call it, you know, abnormal grief. No, folks, it's 2 years at least. So anyway, you know, it takes a long time. And so we've learned that, you know, I just eat something, drink something, and I can quell those emotions because it's all the same neurochemistry. So that, you know, the greater demand. When we think about COVID, what is happening to people? They're not working. They're fearful of their financial security. I mean, and I guess they're fearful about their physical health. Personally, myself as an addictions doctor, I am freaked out by COVID, not so much by the health consequences, but by the economic and social consequences. And the biggest one being, aside from these, which are big, is social isolation. We tell people to isolate. We cannot be isolated. We are social creatures. I feel people are in peril, especially ones who live alone and are following the rules to the T and are literally isolated for a year. That really worries me.
Thank you for sharing that. It is a perfect storm. All right, let's. This question taps into that, and then I think we're going to have to wrap up on this. Dr. Tarman referred to something about the importance of spirituality. Can you come from a different direction?
You mean, can you think about the spiritual dimension and not call it spirituality?
I believe, and if the person wants to unmute themselves, you're more than welcome to, but I believe that's...
Yeah, without referring, it's Kathy here, Dr. Vera.
Yeah.
I'm just wondering if you can come at that, taking out the spiritual element. Can you describe what is happening without that word?
Okay, I mean, really what I think is happening here is that, especially with addiction, but human nature is that we need to search for something bigger, different than ourselves. The ego is, you know, it's very primal. It's part of the reward pathway. It's part of the, it's not part of the, it doesn't encapsulate the right side of the brain. It's very much focused. It's great for stress. It's great for stress. It's great for negative. But if we want to open up the positivity, we have to find other ways. And that means it has to be out, basically the concept of surrender. Like spirituality only works because it opens up the pathways to metaphor, to poetry, to surrender, to something greater than. It doesn't have to be greater than, just not me. And also, I think it has to have a feeling of wonderment, of basically not me, and with a sense of wonder. It has to be bigger than me. Because remember, dopamine, we live in this little world of, you know, the pleasure of an apple. Every once in a while, it might only be 3 times in a lifetime. You know, the thing with addiction is you get greedy and you want it every Friday night or every night after a hard day. But, you know, once in a few times in a lifetime, you have these experiences of, oh my God, life is, you know, the connection of the universe, and it's beautiful and it's bigger, and I'm an artist and all that. And then it goes away. But that experience is a dopamine plus, and that motivates us to get through the hardships of the day-to-day. And we have to have a taste of that. The problem is that's the thing that gets hijacked with food. And anyway, so when we quit the food, I don't want to be now into the dungeon of Vera and my day-to-day stresses. But if I'm not going to use the word spirituality, I personally use the word, like this is in the 12-step program. You know, sometimes we say the word God, good orderly direction. I have a sense of mission, which is this. I mean, I'm now in a spiritual mode because I'm teaching this, and I'm very fervent and passionate about this. So sense of meaning, sense of connection, that stuff, which spirituality is just one shortcut formula. Either the newer version of it or the older versions of it.
I love that term, wonderment. There's a question from the floor.
It's dopamine.
For resources, I think I know the answer in terms of resources. One final question, and I think it might be a short one. Is abstaining a good safety measure to deal with your trigger?
I think it's the only one that works, because otherwise you're just teasing yourself. It's like you're hovering. When people think about how do I quit? The good news is it only takes a few weeks. But if you are not abstaining and just cheating here and there, you're just keeping that process. Because essentially what happens is you've neuroadapted to needing more here. And then when you stop, you're over here, it hurts, it's painful, that's post-acute withdrawal, but then you neuroadapt back to normal. Well, if you keep having that one cigarette every once in a while, or that one latte once in a while, you never get to the place of neuroadapt, of basically, getting back to stage one. So I think if you want to have a contented sobriety, abstinence is the way to go. If you don't care and it's not that hard and you don't mind, then go ahead.
I think that's an excellent way to summarize. I will give you the opportunity for any parting words, but yes, it really is the only way to quell that addiction monster, or in your book you call it a creature, is just not to feed it. Every time we give it a little bit, it wants more. So a very heartfelt thanks for me and everybody at Moto Nation for joining us today. If there's any last words, I encourage people to stay with us. We are going to formally wrap up the workshop, and we'll have an opportunity to reflect as Dr. Tarman leaves us. But any I think it's parting shots, parting words.
Yeah. Parting shots is that, yes, please, if you're interested in additional support, it's not enough by any means, but the Facebook group, I'm Sweet Enough, Sugar Free for Life, please join that. It's going almost 5,000 strong now. And it's always, you throw out a question and you'll get 10 different answers from different perspectives. It's really wonderful to read it. And the podcast, of which Tony was one of our first speakers, illustrious speakers. We're trying to get all people in the food addiction field, and maybe not quite in the food addiction field, but interested in the concept of food addiction, all the different angles, so that we can kind of get a public-friendly understanding about food addiction.
Yeah, the podcasts are excellent. We've shared a couple tidbits from Michael Moss and Dr. Ravina in our workshops, and that's what we do here every Saturday morning. So again, a big thank you. I know you got a 10:30, so thank you from all of us. Okay, and again, for those of you with us, just stay with us for just a moment. But thanks, Dr. Tarman.
Okay, thank you, Tony, and thank you, everybody.
Here we go. Okay, thank you very much. I'm going to share one tidbit from her book, and then we're going to wrap up formally, and I encourage you to stay with us, and then you'll have an opportunity we can chat amongst us. But I have one little tidbit from the book that I'd like to share. I think it's where the book itself is wonderful. Okay, it's a little bit of a long one, but I think this does an excellent job of summarizing the maintaining or recovering part of our journey. Few realize that it is crucial to delve into the details of the lifestyle change. The assumption is that it just means fewer calories and more exercise, and that's the way that weight loss was thought of for the longest time. But truly successful maintainers, sustainers, whatever you prefer to use, would tell you that a life of maintenance is something quite different. It's a well-reasoned, controlled existence that is structured, that's those boundaries and parameters that we talked about earlier, well structured around healthy avoidance of the trigger foods or the triggers in general. Healthy avoidance, I like that term. It involves a specifically designed and executing eating style, a meal plan to represent our way of dietary living, if you will, a reliance on supported environments, all right, Moto Nation here, specific and consistent exercise routines, and the maintenance of extreme vigilance. And if you've ever seen the Craig Ferguson talk about him, his key one-liner is a life of vigilance as it relates to alcoholism and our journey too. It's because that modern food and those bastards that go put it together is addictive, and it takes several layers of planning to oppose it. I think that is one of the best summaries I've seen. We're going to formally wrap up, as we always do, with 20 seconds of audio, followed by the mantra. I'll invite you to stay with us.